I am Tim Maple, Battalion Chief for Lake Havasu City Fire Rescue and EMS Department. Lake Havasu City has been recognized as a heart-safe community, and Havasu Regional Medical Center has been designated as a cardiac receiving center by the Arizona Department of Health Services and Arizona Share Program. Save Hearts in Arizona Registry and Education. In addition, HRMC's chest pain and cath lab is accredited through the American College of Cardiology. Today, we are here to discuss hands-only CPR and its benefits to the public. Here's Dr. Atasi to tell you more.
So briefly, let's discuss what the sign and symptoms of a heart attack. So that traditionally, when someone say having a heart attack or so, traditionally it's basically chest pain, any kind of chest discomfort, chest pain, chest pressure, chest burning. Those are the typical symptoms that people describe. They can describe as an elephant sitting on the chest as well. In addition to that, there are atypical symptoms of having a heart attack. Could be shortness of breath, could be fatigue. All those could be symptoms or early signs of having a heart attack. As we discussed about the symptoms of a heart attack, there's sometimes different symptoms that female can present when they have a heart attack. Again, typically could be chest pain, but female, they can present as shortness of breath, fatigue or so. So sometimes, most of the time actually, female might not have a typical symptoms of a heart attack. So it's very important, if someone experiences any of the symptoms of a heart attack, it's very important is to call 911 immediately. Never ever try to drive yourself or drive your family member. It's very important to call 911. The reason for that, because when heart attack starts, symptoms starts, the way it started, the artery to supplies blood flow, the heart muscle completely closes. When completely closes, people start having symptoms. The problem would be that the heart can stop. It's not stop, it goes very fast, which is called ventricular fibrillation. When people have ventricular fibrillation, there's no blood flow circulating, there's no blood flow going to the heart muscle, there's no blood flow going to the brain, and that can cause damage to the brain at that time. That reason is very important when you see someone in front of you collapsed, you're suspecting having a heart attack, cardiac arrest. It's very, very important for immediate start of hand-only CPR because by doing that, actually you can save this person's life. Hand-only CPR, basically you have to push as about 2 inches down with about 100 times a minute. The purpose of that is because when the heart stops, there's a low oxygen delivered by the blood to the brain, and even for a few minutes that can cause brain damage. By pushing on doing a chest compression, that actually pushes the oxygen being carried in the blood to the brain and minimize or prevent brain damage. When we talk about a heart attack, it's very important to know what are the risk factors that increase the risk of having coronary artery disease or having a heart attack eventually. Those risk factors could include hypertension, diabetes, smoking, lack of exercise, high cholesterol. All those risk factors, you can modify them. You can lower the risk of having a heart attack by controlling those factors, by exercising, eating healthier, controlling diabetes, controlling hypertension. Other risk factors that can also be contributing to having coronary artery disease and a heart attack will be family history, or if you have genetic disorder that increases the risk of having a heart attack. Unfortunately, those risk factors, you cannot change them. So you cannot change your family, you cannot change your gender. So you have a risk factor of those, you have them. But what we recommend is to live a healthier lifestyle to modify the other risk factors that we can modify by being healthy, doing diet and exercise.
Every year, nearly 300,000 people die of sudden cardiac arrest. What should you do if you witness a sudden cardiac arrest? First, shake and shout.
John, are you okay? You okay?
Next, send someone to call 911 and retrieve an AED or automatic external defibrillator.
Call 911, give me an AED.
And finally, after you've confirmed the person is unresponsive, begin chest compressions. Center chest at a rate of at least 100 compressions per minute at a depth of at least 2 inches. Use an AED when it arrives. When you retrieve the AED, first turn it on, and then follow the instructions per that unit.
Tear open package and remove pad. Tear open package and remove pad. Tear open package and remove pad. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm.
Don't touch patient. Stop CPR.
Do not touch patient. Analyzing rhythm. Shock advised. Charging.
Shock advised.
Stand clear.
Everybody clear.
Push flashing button to deliver shock.
Delivering shock.
Stand clear. Shock delivered.
Shock delivered. Resume chest
It is now
compressions.
safe to touch the patient.
Your chance of survival decreases 7 to 10% every minute in a sudden cardiac arrest if no CPR is done. Your chance of survival decreases 3 to 4% every minute in sudden cardiac arrest if traditional CPR is done. And your chance of survival decreases 1 to 2% every minute when hands-only CPR is done. Therefore, with a 6 to 8 minute response time in Lake Havasu City and hands-only CPR initiated on a witnessed cardiac arrest, you have approximately 80% chance of survival if this procedure is followed.
I want to emphasize the importance of starting CPR early. If you do hand-only CPR, you will be the person who saved that person's life, and you will be the hero.
The following is a story about a local teacher that was saved by hands-only CPR.
Hi, I'm Donna Mayers. I died July 7th, 2018 from cardiac arrest, and it was very unexpected because I'm actually very healthy. I've been a PE teacher for 30 years in Lake Havasu High School, and she saved my life. Kelly was here, thank goodness, cousin Kelly. So I guess they called 911, and she came in and talked to the phone person, the CPR person, and she's certified, and she did hands-only CPR on me for however many minutes it took. Do you remember how long?
Chest compressions, probably about 7 to 8 minutes. Seemed like a lifetime.
Yes.
So I came down there, and there was a crowd around you, laying on the floor. You were on the floor. And I came down and said, "What's going on?" And my cousin yells out, "Something's wrong with Donna." Her daughter-in-law was on the phone with 911. Her husband was at the foot of her, holding her neck. And they asked if someone knew how to do CPR. So I was in the military for 10 years. I was also a lifeguard in my younger years, so I knew how to do CPR. The operator on the phone asked if I was certified. I said yes, and she told me to get going. I kept checking her pulse. Her husband, Al, was checking her pulse. Then when the paramedics got here, they said that you had passed and they brought you back. They said that if you had not had CPR, though, you would not have made it to the hospital. I think what's really scary, and especially being in the military for 10 years, is that a large percentage of population doesn't know how to do CPR.
Right.
It's very important. Anybody in the community can take a class.
Mm-hmm.
Like I said, I was in the military for 10 years. It's the very first thing they teach you in first aid in the military. And I mean, obviously I was just in the right place at the right time, and we are forever bonded.
Yes, we are.
Because of it, but it's really important. I mean, especially kids in high school, stuff like that. I mean, your parents, your grandparents, your brothers, your sisters, it's always good to have somebody in the house certified.
Right, it really is. And even you can even Google it, you can find it online too. But I really appreciate our city trying to make sure all our students have this knowledge, because it's vital. So I'm really happy that we're getting this training in our schools.
Yeah, that's going to be a good program.
Thank you for saving my life.
You're welcome, my soul sister.
Yeah.
Their heart.
Your hands.
Save a breath.
Save a life. This public safety announcement is brought to you by Lake Havasu City Fire, Rescue, and EMS Department, Havasu Regional Medical Center, the Arizona Share Program, and the Arizona Department of Health Services.